Hi there, my name is Jennifer Tran, and this is my pocket guide for NU664D Primary Care Adult Women. So I've chosen to use a spiral index card to make it more convenient to bring into clinicals. For last semester in health promotion, I used a binder and it was a little inconvenient, so I learned my lesson. So for my first card is the table of contents. I've chosen to put in ICD-10 codes, cervical cancer screening guidelines, the Gardasil vaccine information, contraception, the menstrual cycle, amenorrhea, abnormal uterine bleeding, STIs, and the UTI empirical antibiotic selections for acute simple cystitis for female adults from up to date. So for my first tab, ICD-10 codes. I've chosen to write a couple that I frequently use in clinicals, like disorder of the breast, infections, neoplasma, pregnancy and postpartum, complications, pregnancy, and abortive outcomes. For my cervical screening, I use ACS 2020 guidelines, but I learned in clinical most GYN clinics use ACOG, so I'll change that. I have information on the Gardasil vaccine. I have information on contraceptions. I have the barrier methods, advantages of it, and contraindications on who can't have it. I have the same thing for hormonal. This is just progesterone only. Hormonal COCs, so progesterone and estrogen. This is the menstrual cycle. And you can see I have the endometrial cycle in pink, progesterone in purple, estradiol in orange, LH in blue, and FSH in green. And then I kind of wrote little cheats on which part is part of the ovarian and which part is part of the uterine. I have information on amenorrhea. So this is primary amenorrhea, signs and symptoms, what would you typically see. The treatment is on the back of it. I have secondary amenorrhea, same thing. I have normal uterine bleeding, so I have palm coin, and then how I would treat it hormonally, non-hormonally, and then the third option is surgery. For STIs, I have chlamydia, gonorrhea, syphilis, herpes simplex virus, human papillomavirus, pelvic inflammatory disease, not an STI, but I have vaginitis. And then I basically just rewrote in my own handwriting the up-to-date kind of chart on how to pick what kind of medication to use. So I would just follow whatever color. So if it was a yes, I have green, and if it was a no, I have red, and I would just follow that to pick the correct medication. And then it continues on to the next one. And that is it. And I have a ton more index cards to fill up when I learn more for next semester in 665. Thank you.